Today I am going to repeat the previous class, which I was basically presenting the details about cancer awareness in short. The same thing I am going to repeat the different types of cancers, ribbon, colors, and support strategies. So, as I mentioned earlier, cancer is a complex disease which is the uncontrolled growth and spread of abnormal cells in the body. These cells can form tumors, invade nearby tissues, and spread to other organs that is called metastasis. More than 100 types of cancers exist and classified by the organ or cell type of origin. So please also don't forget to subscribe our channel, which will help you to get update from time to time about all the uh, videos which I'm uploading almost every day. So now, types of cancers, for example, lung cancer, breast cancer, pancreatic cancer, colorectal cancer, many different types of cancers exist, and it is based on mostly cell types or origin. Then we could also look over the importance of cancer awareness. This will help the population to survive and avoid from different types of cancers. It promotes early detection and timely treatment, reduces stigma associated with cancer diagnosis. It increases funding and support for research and patients, empowers individuals with knowledge about prevention and symptoms. There are certain things which needs to be uh, always in your mind, that is lifestyle changes to reduce the risk of cancer. With almost all the diseases, lifestyle changes matters and it could help you to reduce the risk of cancer. Thus, the goal is to empower the community, the need for cancer awareness globally, but also in India. There are different types of ribbon structures with different colors which are used to represent different types of cancer. For example, breast cancer, the pink color, melanoma, black color, lymphoma, lime color, all cancers, lavender, liver cancer, emerald. And then you can see almost every types of cancers have different colors, but there are multiple colors also. So color coded ribbons represent the specific cancers and raise awareness. It is used in the events, campaigns, and by survivors and supporters. It symbolizes hope and remembrance and solidarity. Now, these are another color, then second part, and finally, some different types of cancers. For example, leukemia, lymphoma, multiple myeloma, brain cancer, head and neck cancer, bladder cancer. By the way, these are the cancer types which I am naming here are the common types of cancers. Now there are some also other cancers, thyroid cancers, esophageal cancer, kidney cancers. These are common cancers, but there are some rare cancers also, which rarely happens. Now, there are some dates, months, which have been fixed for different types of cancer. For example, in January, there is cervical cancer awareness. February, National Cancer Prevention Month. Gallbladder and bile duct cancer. March, colon cancer, kidney cancer, multiple myeloma. April, testicular cancer, esophageal cancer, head and neck cancer. Or you can also say oral cancers. Then May, melanoma cancer, skin cancer, brain cancer, bladder cancer. National Cancer Survivor Month. July, sarcoma or bone cancer. Then August, this is kind of, they say, please consider making a donation of hope. towards the prevention, treatment, and control of cancer. So you can also say this is kind of cancer support months. Then September, childhood cancer, gynecological cancer, leukemia, lymphoma, ovarian cancer, prostate cancer, thyroid cancer. October, breast cancer, liver cancer. November, pancreatic, lung cancer, stomach, cardiac, that is carcinoid cancer, and then honoring caregivers, that is the doctors. So breast cancer awareness, as here you can see the mention. Then World Cancer Day. There are different dates also which you need to remember if you are really going to make some awareness programs related to cancer. Then what are the factors which are associated, like common factors? It's not everything. Prevention and early detection is the one of the most useful thing for cancer prevention and awareness. So regular screening, for example, mammograms, colonoscopies, HPV, hepatitis vaccinations, healthy diet, physical activity, and avoiding tobacco and alcohol. Know your family history and risk factors. So in developing countries, what we are mostly missing about early detection program. Here, what we are used to do is when we have some problem, then we approach. But we do not care that we need to go from time to time, for example, every 2 years, 5 years. I think it is recommended to go and check if we can, if someone can have any kind of life-threatening diseases and go for early detection program. And that is always beneficial to avoid the things. Next part is how to support cancer awareness. For example, support the fighters, admire the survivors, remember the angels, and never ever give up hope. Participate in awareness events and fundraising walks. Share educational resources in your community or online. Volunteer with local cancer organizations. Support cancer patients through donations or advocacy. Promote cancer and cancer awareness. Aware, be aware, be united, and stay strong. Every voice matters, every voice counts. Then let's go for next part. Summary and call of action. Awareness could save life. Early detection is crucial to avoid cancer. Ribbons are symbols of support, strength, and remembrance. Get involved and be a part of the change. Educate, advocate, and support those affected by cancer. Again, I'm coming to the point. When you are going to donate in the name of religion to any religious system, it's always good to go and support the research hospitals and directly to the patients instead of going to so many nonsense things. So it's always better to support the real needy, the patients. For example, the cancer patients who do not have financial capabilities, but they need the support. So please support them now. As I mentioned earlier, that I will be discussing each type of cancer one by one so that it will really help the population to save and avoid the cancer. And one of the first cancer which I'm going to introduce is breast cancer and clinical pharmacy approaches and how to avoid the breast cancer things. Know the details about breast cancer. So, in general, breast cancer starts when cells in the breast begin to grow as uncontrolled way. These cells usually form a tumor that can often be seen on an X-ray or felt as a lump. The tumor is or could be malignant, that is cancer, if the cells can grow into or invade in the surrounding tissues or adjacent tissues or spread metastasizes to distant area of the body. Breast cancer occurs almost entirely in women, but men can get also breast cancer. That is quite rare and less chances in men. But women have most chances. So breast cancer is quite common cancer among women throughout the world. But India is also one of the most affected in terms of breast cancer. So, if you want to know the anatomy and physiology of breast cancer, breast, first let's go for breast. Then it could be considered, in general, I'm saying, breasts are made up of fat, glands, and connective tissues. It has several lobes divided into lobules and end in the milk glands. Tiny ducts run from the many tiny glands and connect together and end in the nipple. Now, this is basic about breast. Now, if you want, how